Hello friends, today we are going to discuss the problems of eyes, which is glaucoma. Glaucoma is also called as the silent thief of sight because there are no symptoms of glaucoma during the earlier stages, and when the symptoms appear, almost 40% of the vision is already lost. Before understanding glaucoma, let's understand the functioning of the eye. The eye functions like a camera. So in that we have a lens, the cornea, and that projects the light on the retina. The retina converts these light impulses into electrical signals and sends it to the optic nerve. Whenever this optic nerve gets damaged because of the high pressure in the eye, it is called as glaucoma. There are two types of primary glaucomas. One is the open angle glaucoma and the angle closure glaucoma. Also there is secondary glaucoma, which may be because of eye trauma or due to some medications also. Glaucoma generally develops at an age of 40 years and above, but in some children we can have a congenital glaucoma or a developmental phase also. What are the symptoms of glaucoma? The problem with glaucoma is that it doesn't produce symptoms at an early stage. Only symptoms which are produced are like the less vision, in contrast being lesser. The normal intraocular pressure lies between 10 to 21 millimeters of mercury. Whenever there is a rise in intraocular pressure, this causes a mechanical damage on the optic nerve. Because of the increased eye pressure, there is a compression of the optic nerve. Also there is a second theory of ischemia of the optic nerve, and because of this the optic nerve gets damaged, and that's how your vision gets affected. The symptoms of optic nerve damage is loss of peripheral vision, loss of contrast, and eventually the patient develops a tunnel vision. That means he can only see centrally, the peripheral field of vision is lost. So how do you diagnose glaucoma? Glaucoma is diagnosed by doing some eye test. The first important eye test is checking the eye pressure, which is called as tonometry. Now the eye pressures can be checked by applanation tonometry or by non-contact tonometry. Second important test is called as gonioscopy, in which you check whether the angles are open or closed, because the treatment varies depending on what type of glaucoma the patient has. The third and the most important test for glaucoma is the visual field analysis. In this, we chart the peripheral field of vision and come to know whether there is any optic nerve damage because of development of peripheral field loss. Nowadays we also have an OCT scan, which is called as the optical coherence tomography, in which we check the optic nerve and compare the optic nerve with a similar aged person's optic nerve, and if it shows that it is below 95 percentile, then it indicates features of glaucoma. So these are the various tests we do to identify glaucoma. Now what is the treatment of glaucoma? The treatment of glaucoma entails 2 or 3 main things. One is the topical drops. We have a good area of drops where we can control the eye pressure. The primary treatment of glaucoma involves controlling the eye pressure and preventing the further optic nerve damage. So we have topical drops which not only help in controlling the eye pressure, but also give a neuroprotection. That means it prevents the optic nerve from getting damaged further. Second treatment, as I told you before, is the laser treatment. Laser treatment is used for angle closure glaucoma to make a small opening in the iris so that the fluid which is formed in the eye can flow freely. Also sometimes lasers are done for open angle glaucoma. The definitive treatment of glaucoma is surgical. In this, the surgery which is normally performed is called as trabeculectomy. Nowadays we have some valve or shunt surgeries also which can help in controlling glaucoma. But as you realize, the most of these treatments are only for control of glaucoma or control of eye pressure. They are not able to reverse the changes which are developed because of glaucoma. So my sincere request to all of you is that we need to prevent glaucoma, and in order to prevent glaucoma we have to have a comprehensive eye evaluation, and every person who is above 40 years of age should have this comprehensive eye evaluation done, especially with a family history of glaucoma. the chances of glaucoma would be very high, and so a person who has an history of father or sibling having glaucoma should get preemptively checked for the eye pressures and for the visual field analysis. Thank you.